Later. Just before I introduce our next speaker, just to give you a little bit of an idea of the structure of this, we had the introductory context and comments from the Minister, of course. Now we're going to hear several presentations about the policy environment and some evaluation of policy. And then we're going to talk about some case studies as well. And then we're going to hear a not-for-profit perspective and also a community perspective as well. So we're trying to round it out so that we've got quite a broad perspective of views and diversity of opinion and thinking here that we can actually bring to the table a little bit later. And as we go through and have those breaks, as I mentioned, that'll give you some opportunity to reflect and get to know people on your tables, but also to think of some questions that you might like to use, because we really want to see this later on as a two-way discussion, not just a panel up here responding to pre-programmed questions, but we want to get as much interaction and dialogue as we can. So keep that in the back of your mind as we go through the morning. Okay, well look, I'd now like to introduce our next speaker, and that is Ruth Ambler. Now Ruth is currently Executive Director of the Cabinet Office in the Department of Premier and Cabinet. She's been in the public sector for approximately 15 years, and most of those at the executive level. Ruth is a very proud public servant and is passionate about delivering public value in all its diverse forms. Prior to working in government, Ruth worked for Oxfam for 10 years and briefly for University of SA, so some good cross-sectoral experience, Ruth, I'm sure you can bring to this discussion. Ruth holds a master's degree in public administration. She's been involved in IPPA for several years and starting out as a mentor, and is now a divisional counsellor with IPPA. Ruth's presentation today will focus on the role of policy officers in the collaborative process and the role that collaboration plays in building legitimacy for policy ideas. So welcome, Ruth. Looking forward to your presentation. Thank you.
Thanks very much. President Irma Ranieri, fellow speakers, IPPA sponsors, IPPA members and distinguished guests. I'm very excited to be here today to speak to you about collaborative policy development, because it's something that I feel like I've spent most of my career working in various forms, and something that I feel very passionate about. So the first thing that I did want to talk to you a little bit about is my experience in Oxfam. Ian mentioned that this was really my first proper job, was working with Oxfam. And I was there for 10 years, and one of the things that was very clear about working in that organisation is that we couldn't do the work that we needed to do without creating partnerships and without collaborations. So here we were, sitting in a developed country, raising money and working with local NGOs. And if we thought we had all the answers to the difficult social and economic problems that they were facing, then we were kidding ourselves. So collaboration was very, very important, and understanding as well that we may have brought some things to the partnership, which we clearly did. We brought resources, we brought some skills, but the people that we were working with in the developing countries and the NGOs had an incredible number of skills as well. They had lots of resources and they had local relationships and local networks. So it's valuing, I think, what you bring to those partnerships. So when I came into government, and it was 15 years ago, despite my youthful appearance, I suppose it was obvious to me that we couldn't do the work that we needed to do without collaborative partnerships. But I have to say it was a bit of a culture shock. I did go to the University of SA in between, so luckily I then worked in another big bureaucracy. But when I came into government, I think one of the things that did surprise me was just, I guess, the complexity of the environment and the authorising environment. But also, at times, the lack of willingness to engage with others, and the concern and the sort of risk aversion at times about picking up the phone, sharing information, working collaboratively. And I do remember actually one of the things that I think my first performance development discussion that was had when I came into government, and my director said to me, "Look, you're doing a great job, I love everything you're doing, but probably the only thing I could say is that sometimes you don't think about hierarchy very much, you just pick up the phone and talk to anybody." And I thought, not sure whether that's a strength or a weakness, but anyway. Coming from a small single-focused NGO, as I said, it was interesting just to compare some of the complexities of the environment that I'd come into. But of course, the central focus of the work that I was doing at the NGO and the focus of the work that we do in government really is very similar. I mean, what we're focused on is we're custodians for people's money, essentially. So in government, we're custodians for the taxpayers' money, In Oxfam, we were custodians for donors' money, and what we needed to make sure we were doing was spending that money in the most efficient and effective way that we could to deliver value for those that were supporting us and value for the community. So the technical elements and the decision-making processes may have varied, but the intent was really the same. I want to give you some brief examples now of where I think collaborative policy development and collaborative work in government has worked really, really well. The first one is actually a dental service example, and I've got some of my colleagues sitting at the back of the room. So this was, and then when I look back on this, it was actually almost 10 years ago now, which is a bit scary. As I said again, given my youthful appearance, you wouldn't believe that. But this is when I was working in the dental service, and we had a particular problem about the number of emergencies that were being dealt with. So there were lots of people coming through the door who we were having to essentially patch up and then send away and put on the waiting list. So we didn't actually really deal with their underlying problem, but we might have dealt with the issue that they had on the day. And dentists were pretty frustrated about this. So they were saying, we're in this business and we're working in the public sector because we believe in what we're doing, but we just feel like we're putting band-aids on all the time and we're not actually tackling the problem. And of course, there are a lot of dimensions to this problem. So, dental care is an economic issue as well as a social issue. So people who are attempting to get jobs out there, for example, if you've got bad oral health, there's lots of studies done that show that that does influence people's views of you when you go into an interview. And of course it's a social issue because obviously we don't want people to be in the community who are suffering poor oral health care and all the attendant problems that come with that. So we worked with the University of South Australia, the University of Adelaide, so the Australian Centre for Population and Oral Health, who developed a very well-researched triage system that could be done over the phone. So it was an evidence-based set of questions that could be asked of patients to identify whether they really had an emergency. Or whether it was something that could perhaps be put on the waiting list, and then we could actually deal with all the issues that they had and the underlying concerns. Now, of course, going to a sort of computer-based, phone-based triage system, as you can imagine, which might mean that we're turning people away who think that they've got a problem, as you can imagine, wasn't going to be uncontroversial. So we, and picking up on some of the Minister's comments, we really had to sort of build the legitimacy for this. So we felt that we had a good solution to a problem. We felt we had a burning platform for change because we clearly had an issue with the way that we were spending our money and not spending it in the most effective way to get the best oral health outcomes. But we needed to build legitimacy, so we couldn't just decide that we were going to do this. So we had to, of course, convince the Minister at the time, John Hill, and I'd have to say he was fantastic and really backed us. But we also had to convince our constituents, so we had to convince dentists out there who were actually going to be doing this work, and we also had to convince the representatives of the patients. So we did lots of roadshows, we went right around South Australia, we talked to lots of people about the need to do this, and we built that legitimacy. And the outcomes were fantastic in the end. So there ended up being, over a 2-year period, the waiting list was reduced from 56,000 to 32,000. So what this meant is we were doing less emergencies because we were triaging them, and we were then able to treat more people off the waiting list. And so we had $2 million that was redirected from emergency care to preventative care. So a really great outcome, not an easy thing to do, but a really great outcome, and a really important collaboration that we had to undertake to get that happening. And we ended up winning a Premier's Award for it as well, so that was good. And perhaps that tends to the Minister's points about rewards also, rewards for the right sort of behaviour. The next one that I want to talk about is Disability Justice Plan, and again I see some people in the room who've been involved in this, so all of these have been team efforts. So again, a very difficult problem that we had to deal with. People will probably remember some of the court cases. So we had people with disabilities, children with disabilities who'd been allegedly abused, and we were not able to undertake prosecutions because there was no reasonable chance of success, given that those individuals weren't able to give evidence. So, you know, we've got an issue then where we've got people in the community who are very vulnerable and potentially being preyed upon, and, you know, we were sort of saying, well, surely we don't want to live in a society like that. We've got to be able to fix this in South Australia. We've got to be able to protect vulnerable people. So, again, we undertook a pretty comprehensive consultation and engagement process. We had a massive steering committee, so we engaged all the people that we needed to across government, because fundamentally this was a problem where government needed to change its behaviour and we needed to change legislation as well. So again, we needed to build the authorising environment about what we were doing. So yes, we had a huge steering committee, and I must say it was an incredible challenge to chair that steering committee. But we had some fantastic debates around the table, I'd have to say. So we went out and about again. We went to prisons and visited people with disabilities. We met in coffee shops with groups of people with disabilities. We went to people's homes and met with parents. And we engaged with lawyers as well. And one of the things that we did, I think that was really important in that, is that we got together people who had opposing views and facilitated a debate amongst them. So we had, for example, advocates of people with disabilities saying, well, you know, surely we've just got to be able to make it so that we can get convictions, and, you know, various pieces of evidence must be admissible in court. And then, of course, you would have the lawyers reasonably saying, well, yes, but if you've got somebody accused of a serious crime, you've got to be able to prove that that's actually the case. And so we did a lot of work to work our way through a proper plan which has a whole range of different aspects to it, which will hopefully make the lives of people with disabilities much better and really solve that problem over time. And again, we couldn't have done that if we didn't collaborate, and we couldn't have solved some of those problems if we didn't collaborate, because we didn't have all the answers. And I think that's a really important thing about collaboration, and again, the Minister touched on it, is inevitably when you go and talk to people about an idea, your idea will improve. You will take on board the discussion and debate that you have with those people, and you'll refine things, and then there may also be fantastic innovations that just come out of that, fantastic ideas that you will get from collaborating with people. I also want to just mention a couple of other examples quickly. One of them is a piece of work that we're doing with the ICT industry. So it's not a sort of a social policy example, it's actually more about procurement. And what we've done is we've gone out to the market and we've said, as government, we want you to come and tell us, ICT suppliers, what you can do for government. We want you to focus on digital by default, on services to citizens, efficiency and creation of jobs. And we received 187 expressions of interest from the ICT suppliers. And the reason that I mention this, because you might be thinking, well, what's that got to do with collaboration, is that it is a completely different way of government working with industry. So while it's still a competitive process and we still need to maintain probity, instead of thinking that we had all the answers, we've gone out to the suppliers and said, well, actually, we know you've got all these great ideas, but up until now we haven't really been able to deal with them, because every time we issue a call for tender, we've specified it, you know, down to the last widget. So therefore you're not able to give us your fantastic innovative ideas. So it's much more a sort of collaborative way of working, and we expect that out of this, apart from being a reasonable amount of transformation in how we do our IT over time, that the next stage may well include some direct negotiations or some sort of collaborative partnering with industry to deliver what we need as government and what we need as citizens. The other one that I wanted to mention briefly is the unsolicited proposals process, and that's a little bit in that vein. So that's really saying to both industry and community groups, if you've got an idea that you want to partner with government on, come and tell us. You know, come and put in a bid and see if we can work with you. So it's a different way of government working with those that are outside of government in a partnership arrangement. So to balance up these good news stories, of course, because I think they are really good news stories, you probably expect me to give you some examples about where collaboration hasn't worked particularly well, and I'm not going to go into that because I think it's probably not very fair to my colleagues, or to me actually, because I can't say I've never stuffed anything up either. But I can give you, I guess, a bit of an overview of my experience being Executive Director of Cabinet Office. So I've been there for about 8 months now, and one of the things that has surprised me, even given the amount of time that I've worked in various departments across government, is just the number of proposals that do get to Cabinet that haven't been well consulted. And so one of our jobs is to be a bit of a gatekeeper. So, my job is to actually make myself unpopular reasonably often. And so we get proposals and we vet them and we say, okay, so, this is a particular proposal, has an impact on health, has an impact on, wherever. And have you spoken to anybody there? Are health supportive of it? Do you understand what the effect on the community is? Have you consulted with the community? Does it impact on business? Does it have an impact on the regions? Now, people get a little cranky with us sometimes when we are asking all those questions, because of course they've been beavering away on this thing, developing up this fantastic proposal, but sometimes they've forgotten some of those steps. And look, I do realise that there are time pressures, obviously, and I'll come back to that a little bit later, but it's almost, people feel like it's going to take too long to go through those steps, but the difficulty is once they actually get to the Cabinet point, if they haven't gone through those steps and the whole thing is halted because they haven't done that, then really it's kind of a false time economy, really, isn't it? Because it's not going to proceed anyway. Okay, so I just thought I would give you a quote. I don't know if everybody can read this down the back, but this is a quote from Mark Moore, who's written a couple of books about public value, and this is from his 1993 book, Creating Public Value. And it talks about the task of building support and legitimacy for a policy, or of enhancing the effective claim that an official may have on society at large, is what political management is all about. In short, political management shapes mandates for action and invests them with the political support and legitimacy that managers need to direct operations and achieve the mandated purposes. And really that quote just serves, I think, to reinforce the things that the Minister said, and that is that when you're working in government, and particularly when you're working in policy, that building that legitimacy is part of your job. It's not an adjunct to your job or an annoyance that you just have to do. It's actually part of your job. And I think that's something that's very important and sometimes flips people's mindset when they realise that it is a core part of what they need to do and not just something that they sort of have to tick the boxes, I suppose, to try and get their proposal through. The June edition too of the Australian Journal of Public Administration dealt with the difference between the academic literature on policy development, so the thinking about the policy cycle that a number of you would probably be familiar with, and the actual reality of policy development. And I'll just read this quote as well. It talks about the reality of policy development differing from the texts, and he says, people describe to me policy processes constituted not by order and rationality, but by uncertainty, interpretation, contested meanings, power, volatility, compressed views, and time and space, and partial information. And I must admit, when I read that, I thought that sounds like my life, is that's what I spend a lot of my time doing, is working my way through that. And I very much see my role as Executive Director of Cabinet Office as helping agencies to work their way through that. And my staff as well spend a lot of time out with agencies building relationships so that we can help people through that. Okay, so I thought I would just talk a little bit about barriers to collaboration and then some of the really positive things I think that are happening to try and to continue to work on this. As the Minister said, this isn't the beginning of a journey. We already do a lot around this, but we need to do more, and we need to keep working very hard to make sure that this happens. So the barriers to collaboration, as I see them, And I have to say, sometimes they're real and sometimes they're perceived. I think sometimes people feel that they're barriers, but they haven't actually tested them. You know, they haven't sort of said to their manager, can I pick up the phone, can I go and talk to that person, whatever. So I think timeframes are a barrier. And that's both, you know, real time frames. So sometimes we get real time frames. If the Premier says to me, I want this in Cabinet next week, that's a real time frame to me. But sometimes we limit ourselves and we don't think about the proper time it's going to take to do the consultation. Also a limiting factor can be authority, because we know sometimes that managers and other people in bureaucracies will block people who want to be more innovative and who want to be more collaborative. And again, sometimes that's real, sometimes it's not. And ministers also can do the same, let's be honest. Sometimes it's the minister saying, no, we don't want to talk to anybody else about this, we're going to develop it within our department. There are also probity issues, and I mentioned earlier the sort of ICT EOI that we've got running at the moment, but also when we're making funding decisions about NGOs and things like that, we want to have a collaborative partnership with NGOs, but we also fund them. So those are complex issues. How do you have a partnership in a situation where there's competitiveness as well? Not impossible, but they're complex. Also power, you know, again, let's be honest, sometimes people don't want to give up power. It's my idea, and I don't want anybody else to take credit for it, so I'm not going to talk to them about it. It doesn't work particularly well, actually, in my experience, when you try and do that, but, you know, people still do. Budgets, the Minister mentioned budgets, accountability, and we do need accountability, but surely we can design a better sort of accountability that's a bit more multilateral. Complexity, because these issues are really complex, and how you work in a collaboration is really complex. I mean, if you think about, for example, the recent bushfires, which is something that some of us in the room have been very, very involved in responding to, I mean, that is a huge sort of machine almost that, you know, there's a whole range of different roles from different organisations, and you've got to fulfil your role and not go outside of that. So you've got to understand what that is to start off with. So you know, it's complex, it's difficult to do. And I'll say fear as well, because I think sometimes people are quite fearful of exposing an idea or a piece of work in case other people say, oh, well, that, you know, gee, I didn't actually think that was very good. So, you know, people have a natural reticence, I think, sometimes. Okay, so how are we dealing with this, and how do we need to continue to deal with this? Well, I think a lot of it is about culture and values. It's about leadership, which the Minister mentioned. But it's also about structures and processes. So, you know, it's not just, when you talk about values and culture, it's not just some sort of airy-fairy thing that we say, oh yeah, well, we're all going to change our culture and feel good about it. That's hard work, and it's some of the hard work that Irma's doing and her team, but we all need to do it in all of our departments. Through things like the Cabinet process. So we do have processes, as I mentioned earlier, of checking where the collaborations happen. So there needs to be checks and balances, there needs to be accountability. There's also a 90-day project that's happening at the moment that's developing some tools, some training about collaboration and collaborative policy development. So again, some of those things are important. Also, I've established a policy network. So we've got a group of people who are coming together on a regular basis to think about these things and to think about what it means to be a policy practitioner, what it means as a profession to be a policy practitioner, and leadership. You know, we have clear leadership from our Premier, and we all need to exercise that leadership as well. And I'm just going to end with a very quick message, because I know that Ian's looking at it because I'm out of time. And that is about personal responsibility. So I've talked about leadership, but that's not just about the Premier, and it's not just about me, it's about all of you. And I think everybody in the public sector really needs to take responsibility for this. I'm not saying in a career-limiting way, you know, but, you know, push the boundaries a bit. Talk to your manager if you think you need to collaborate on something, or you think the stakeholder's been missed out in a policy development process. Push the boundaries in a gentle way. And, you know, a lot of the time I think you'll find that some of the barriers you thought were really there are, in fact, only in your mind. So I'll finish on that note. Thanks, Ian.